Good morning, everybody. I hope everybody's doing well. I'm going to make this YouTube video and I hope that everybody enjoys this time that we had together. Anyways, I wanted to make this YouTube video and I wanted to talk about a little bit about what I found out being in working in the healthcare field and I'm a caregiver now. I'm a paid caregiver, but also I wanted to tell you guys a little bit about my thoughts about the hospitals procedures and the way that the hospitals run nowadays. Um, Hope everybody's having a fabulous Monday morning. Okay, so I'm gonna get into the details. I'm gonna close my door and then I'm gonna go into details about what I think about hospital policies and as to why I feel this way. Okay, so uh little bit about my background and why I'm talking about this and why I feel like this is important to talk about because I feel like a lot of people can get a lot out of this video if you guys, get a chance to watch it. If you like this video, go ahead and thumb up this video. Otherwise, I'm going to tell you a little bit about what I've experienced as far as to, being a caregiver and my thoughts about, how the hospitals run. The hospitals that I had to deal with it because my mom's insurance was Division of Medicaid, and she's been with Mississippi CAN for a while. Now, back when I was living in Louisiana, she had Medicaid. I believe she had Medicaid then too, but I think at that time my dad was working, and so she was actually getting insurance. She was actually getting insurance from him. She she wasn't getting insurance from excuse me guys. She she wasn't getting insurance from Medicaid, the Medicaid office. Like I said, she was primarily getting her. Sorry, you guys. My son is getting in and out of this room, and it's really hard for me to concentrate and do the same thing. She gets so distracted. Anyways, okay. Now that I officially locked my door. Anyways, you guys, my son is a lot to deal with. Anyways, back to what I was saying. The first time my mom had a division of Medicaid, um, that was a story in itself. But like I said, when she was living in Louisiana, my mom had my dad's insurance, and at that time, everything was good, peachy clean. Everything was really fine with Blue Cross and Blue Shields, and she was living in Louisiana at that time. Now that my mom has gotten worser, and with her mental health and her physical health state, I had to make certain decisions as my mom's. uh I'm not considered her power of attorney yet. I'd say I've signed paperwork to be in my mom's guardianship, and how that works, guys. There's a lot of technicality in it, so I'm not going to say too much about how I got the my mom's Medicaid waiver and things like that underneath approved. But let's just go further deep down and talk more about the hospitals and what I think about the hospitals in the state of Mississippi. Okay. The hospitals in the state of Mississippi are one of by far the worst. And if you look statistically, the state of Mississippi is one of the poorest states in the country. Now, that's the one of the reasons why I decided I was like, I'm going to move out the hell with this state, okay? Because the hospitals are crazy because they like to make money off of you. When my mom got out of the hospital, she paid about $100,000 of an insurance bill. Now, fast forward, like I was talking about, like these hospitals, I had spoken to several different people, different departments when my mom was in the hospital. I was talking to her social worker, I was talking to her doctors. I had to make things, certain decisions, and I wanted to make this video so that you guys can zone in. And if you know anything about the medical field, it's crazy and bizarre as to how many people have to deal with such craziness. Okay, so I want to kind of, guide you guys through as to how the health department really runs and things like that, and different procedures and things like that. But like I said, in the state of Mississippi, by far one of the worst. If you are looking for getting good health care, go to Colorado, go to states up eastward. Don't go. I talked to my therapist about this, but yeah, go to states up eastward. Like go to California. Go somewhere that's got more funding. If you're looking for a state that isn't going to pay you much for your hospital bills, your whatever cost of things that you need, medical equipment, things like that, and you know that you have a family member who is older, you're going to look at the expenses of things that are going to come out of your damn pocket. I'm just going to be very honest and straightforward with you about that, because it doesn't get any easier when you see uh the hospitals the way they're run, okay? And from far, because I've had to deal with just the whole hospital staff, because my mom, she doesn't understand English, so her broken English caused a lot of conflicts and interactions that I'm not going to talk about them too much, because those are really personal details. But just thinking about the cost of the hospital bills that you get every single month, and then you wonder as to what other expenses do you have. And so that's what I'm really wanting to talk to you guys about, because the biggest thing that I've seen in this state, and then I also saw in Louisiana. Louisiana, I say, has better mental health. I'm not gonna say it's the best. It's definitely not the best. The best, like I said, is Colorado. If you're looking for mental health, California, go up eastward, people. Don't go down south for your mental health. If you want good mental health. If you want good mental health, you better like look up the different states and look up to see how much the cost of living is and things like that. And don't trust people when they tell you that this is better than that. Do your research. If you're really looking to move out because of the things of cost of living and the things that you have to pay expenses for, I understand that, because I'm in the same situation myself. Because I thought to myself, like, decades ago, prices of things weren't going up as much as they have been in this inflation world. Okay, but in the United States of America, you're going to deal with debt. The debt that has have been going on for years now. And when people are telling you that there's no debt in the United States of America, there's plenty of debt to go around. I mean, you got medical bills, you got household mortgage, utilities, rent, things like that. And you're going to question yourself as to why the healthcare costs and the healthcare living it's not just because of politicians. It's not to say politicians don't make up for what they've done over the past years, but Joe Biden hadn't been any better than what it was. Unfortunately, he created a mess. That's what he did. He created a mess in the United States. He created a mess that now Donald Trump is now trying to take over. Now, my thoughts about China, and I'm not going to go too much into detail about this, but I had a conversation with a friend about China. China is still looking poorly. China still's got COVID. China's still got a lot of craziness, and now that during the pandemic, I mean, in the state of Mississippi, you ain't got to worry about the pandemic too much, but if you're looking at about the states that have more people, yeah, you're gonna have to worry about the COVID a little bit more. But I would think about it, but I wouldn't put it to my head too much because there's a lot of different diseases that kill off people. Cancer can kill off people. All kinds of things can kill off people. Diseases that are hereditary can kill off people. All kinds of different things. But in my opinion, as long as you working towards what you can and building a good mental health state, because a lot of diseases come from stress, and stress is built on it manifests when you got too much going on, and when it's too much toxicity in the world. But anyways, going back to what I said about hospitals, just do your research and really look to see what type of what kind of reviews do you get when you look at the hospitals. Because when I looked up my mom's hospital when she was at Vicksburg, it was by far one of the worst hospitals I ever seen in my life before, because it was one of the oldest hospitals. Now, the first time I was thinking about putting my mom in crisis unit, but they just talked to good talk, and they talked to good game. Hospitals did, and unfortunately, they put us in a bind. And yeah, but it's just it was the way it happened. But like I said, if you're looking at different good hospitals, just look to see what the patients have to say. Don't look at what the doctors have to say about how bad, what they did in the hospital, whatnot. Look more towards what the patients have to say about how their reviews were at the hospital. Because, like I said, you're going to get some good reviews, you're going to get some bad reviews, and majority of the time when you're looking at behavioral health hospitals, it's just like written all bad. I've seen. I looked up Washington State because I was just curious as to what they would say about their hospital facilities, and they said that they had some good. They had some pretty bad experiences, some horrific experiences. And when people are dealing with mental health, you're talking about substance abuse, you're talking about drugs, alcohol, addictions. A lot of people deal with addictions when they talk about mental health state, because a lot of the people they get so depressed that they end up doing some crazy stuff, and they get addicted to opioid addictions, and they get addicted to a lot of different things. And I get questioned a lot that when I'm in the mental health facility, I mean clinic, and they're asking me, "Oh, did you ever kill anybody? Did you ever kill anybody?" In my head, I'm like, what? Like homicide? Me? Like did I ever want to kill anybody? Not specifically. Did I ever want to punch anybody in the face? Possibility, but did I ever want to kill anybody? No, not likely. Not me. But you're talking about drugs and alcohol and all that, but oh my goodness, the world is full of craziness. It's full of craziness. It's full of opinions and things and thoughts and ideas of what could be. But like I'm saying, just do like I said, just do your research, people. And if you feel like there are concerns, talk to the hospital about it. Like just go inside and see like what you think of it, because that'll give you a good feel for anything. Like if you're moving somewhere, you would like to see like how good of an environment it is, just like a hospital. You would like to see how the environment is, especially if you have a loved one in the hospital. That's a whole different story for a whole nother day. Not really, but it pertains to the same thing we're talking about. But to elaborate on that more, yeah, I'll probably have to do a whole nother YouTube video on that. But anyways, I hope you guys enjoyed this video. Um, I don't know when I'll be doing my next one, but you can look forward to another YouTube video later on, you guys. I hope you guys enjoyed this video. Until then, have a good one.